your plan. You need a good monitoring system, and you need a good, fantastic partners, a vibrant private sector and innovation partners to deliver. Because as public institutions, we are busy with regulation, we are busy with policy. For implementation, you need to have a strong private sector partner to deliver. And most importantly, you need political will and citizen engagement or citizen buy-in. These are called foundational building blocks. If you want to create a fantastic, iconic building and get a fantastic building up and running and usable, you need a robust foundation. You need not only the superstructure, but you also need a strong foundation, which I discussed about policy, regulation, institution. These principles encompasses what is called citywide inclusive sanitation. Citywide inclusive sanitation is about getting certain outcomes of safety, equity, and citywide with robust foundational building blocks, as I said earlier. Now, the next question is, what is our benchmark? What do we mean by safe sanitation, and what do we mean by a CWIS, a good benchmark for sanitation? Now, a decent benchmark, not a gold-plated benchmark, a decent benchmark for us as practitioners for delivering sanitation is very nicely articulated in the SDG, Sustainable Development Goal 6.21 and B, which says the population should have improved sanitation facility, not a kacha facility, but a pakka facility, safe sanitation facility, which is well defined, which is not shared with other households. Mind you, it is not shared with other households, and the excreta that is flushed out is treated or disposed in situ, that is, or it is temporarily stored and emptied and transported to a different location, off-site location. There are solutions like in many countries, like in Africa, even in Japan, in the past, they are called container-based sanitation systems. You contain it and then transport it and treat it. Or even septic tanks, you are containing it, partially treating it, and then transporting it off-site, emptying and transporting it for treatment. And then, or you can flush this waste through a sewer system along with the wastewater and treat it off-site. So this is our benchmark. It is not just about sewerage as a benchmark, but any of these options following the safety criteria is our benchmark. Now, along with this benchmark of sanitation, we also need reliable water supply on the premises, because if you don't have water supply on the premises, the sanitation cannot be delivered. And of course, to cover the very critical component, the hygiene, you have water, you have sanitation, but if you don't have hygiene, then the public health system will collapse. So you need hand washing with soap. So these three components are very well articulated in Sustainable Development Goal 2.1, which is actually our benchmark. I won't say, as I said, it is not a gold-plated benchmark. Many a times we think of only the network system as a benchmark, not always. As outlined, our idea is to get safe sanitation, and safe sanitation can be delivered through multiple routes. Now, poll number 1. Sibyl, can you help me with poll number 1? So I request all the delegates to read this question and then attend. Is it a good practice to promote shared toilet, community toilets? Community toilets are important for ensuring sanitation. Community toilets should be discouraged. How much? 70%. Okay, it's very interesting. So honestly, I can't see. I'm speaking to the screen. Is it because?
Sir, nearly 69% are telling that community toilets are important for ensuring.
Important.
Yes.
Now, can you remove this? Can you remove that? Yeah. So it's very interesting that you feel community toilets are important. Technically speaking, community toilets are discouraged. It's not a sanitation coverage. If a slum has a community toilet and doesn't have individual households, do not have individual household toilets, then actually technically it is not a coverage. Community toilet or a shared toilet is not a solution and it is discouraged. Can you remove it, this poll?
Sir, it's been removed. You just click on the
Okay.
Close.
I'm also just trying to. So if you see the definition, the shared facilities are not a good option. Every household should have a water tap. Every household should have individual toilet facility. There could be public conveniences for floating population, for visitors, and for emergency requirements. But as a principle, community toilets as an option is discouraged. It is not a benchmark that we need to follow. Now, let me proceed further. This is a known thing, but it's very important to contextualize. Now, our job is to deliver sanitation. There are multiple options. One option is reticulated system, as Western communities call it, as we call it as underground drainage or sewerage system, and some of them call it as reticulated system in an engineering way. The other one is non-sewer sanitation, which is basically on-site sanitation like septic tank with a good septage management system. These are the two options. Now, cities in India and in South Asia, they have chosen different options based on the density, based on the affordability, and so on and so forth. This is one option just to reinforce. This is a sewerage option where you have a user interface called toilet. Then you have a collection system through the pipelines. The waste is flushed out through the pipelines. You take it to an inspection chamber. In the past, we used to call them as manholes. Basically, these are inspection chambers. To be gender neutral in terms of terminology, manhole is discouraged now. It's also called machine hole. So from there, it is taken to a treatment plant and it's recycled and reused. These are the 5 stages for a sewerage system. Option number 2 is on-site system. You have a user interface where humans are discharging the waste, the feces and urine and washings, and then it is collected in a septic tank or a pits, and the supernatant means pani jo hai, which is used for anal washing, which is used for flushing, goes through a settled sewer system or a drain. In most of the times in Indian context, it is flushed into a stormwater drain. Ideally, it is not a good practice. It has to go into a soak away. And then the sludge is decanted by a suction machine. In the past, it used to be decanted manually in certain pockets. In congested areas, even now, this practice of decanting is done manually, but it's by and large, mechanization is happening. It is taken through a truck, and then it is taken to a treatment plant called fecal sludge treatment plant and recycle and reuse. Also, you have mixed options. You have both, certain areas have sewer systems, certain areas have on-site sanitation systems. This is extremely common. So these are the mixed sanitation systems that are prevalent in most of our urban areas in the country. Now, just to situate it in a spatial context, in the core part of the city or in certain geographies, we may have a network system called a reticulated system or a sewer system with yellow dots as STPs, or we can have decentralized systems, both at a household level or at a community, gated community level, where you can have decentralized systems which gets treated and then discharged. And then you can have on-site systems, which are like septic tanks at a household level or at a cluster level. And then we can also have on-site pit latrines. And of course, this has been eliminated, which is open defecation. You see, there are multiple options to improve sanitation. It's not just about providing sewerage as an engineering solution. Our idea is citywide safe sanitation. So we have multiple options except this option, which is on the screen, which we have eliminated or almost eliminated. Sybil, can we go for second option? Second poll. Okay, now this poll is about sewer system is difficult to implement due to the following reasons. The question I'm asking is, many a times out of our 4,021 municipalities, there are hardly less than 100 have sewer systems. This is because of high water requirement, high cost, high O&M, difficult to implement because we have narrow roads and gullies and very operational issues. It also requires high technical skill to run sewer systems. So what is the response like? So the response is, majority of you said, 84% said all the above. Some of you said, high cost, high O&M, difficult to implement. So basically the answer is F, all the above. All the above, the sewer system suffers from certain challenges of having high cost, high capital cost, high operation and maintenance cost, large quantity of water requirement. That's why as CPHO norms define as 150 LPCD liters per capita per day. Unless you have sufficient water, you won't get the scouring velocity. So you need above 135 liters per capita per day. Then you need high human capital to maintain it. Then you need high operation and maintenance because you need to do a lot of pumping. Many a times just gravity may not work. You need to have a lot of pumping. So high capital cost and O&M cost. Considering all these reasons, citizens as well as many city governments are now looking at septage management or on-site system with septage management as a solution. That's why Swachh Bharat Mission has funded millions of on-site toilets, on-site sanitation systems. Now these on-site toilet site latrines have come in millions, both in urban and rural areas, and resulting in a fantastic outcome of open defecation free urban areas. So you can see here, we have built this toilet with septic tanks. Now, this is fantastic outcome. But is this good enough? May not be, because the waste coming out of this septic tanks, both liquids as well as sludge, needs safe transportation, safe treatment and disposal. And that's why we call it as, it's not enough. It's not good enough. You can see here, the toilet is getting full. It has to be evacuated. It has to be taken out somewhere. So thanks to mechanization, now this human interface is coming down. It's not completely coming down. You can see in the picture, this is one of the cities where you used to work in the past. People are handling without personal protective equipment. Now things are changing, but this is not a great practice. But at least mechanization has come, and then they take it and dispose in various locations, including water bodies. So this is unsafe sanitation practice. And that's what this program is all about, ensuring safety at every level. Poll 3. What could be the BOD or a biological oxygen demand of septage? Any guess? It's about 250 milligrams per liter. Those of you, some of you may not be completely familiar. It doesn't matter, but just get a feel of the pollution potential, organic pollution potential of this waste, which is coming out of the septic tank, often called as septage. Sybil? Okay, we can stop. Yeah. So about 50% of you said above 5,000 milligrams per liter. Some of you said 250 milligrams. 250 milligrams per liter is a typical BOD concentration in your sewage, city sewage, where your gray water, black water, everything gets mixed, resulting in dilution, resulting in 250 milligrams per liter to 300 milligrams, whereas septage is a nasty stuff, which is having 5,000 to even 15,000. Some of the samples we have taken is also showing 15,000. If the waste is coming from a septic tank, fresh, it has a very high pollution potential. Whereas if the waste is, the toilet is there for a long period, the sludge is sitting there, it's stabilized, and then after 10 years it has been evacuated out, then the BOD concentration could be less. So it varies, it is 5,000. So you can see it varies from 5,000 to 25,000, and it is much more polluting than a conventional sewage wastewater, and that's our concern. It has high concentration of pathogens, and that's why if you don't deal with septage management, if you don't deal with waste treatment in a scientific way, it is nothing but an institutionalized open defecation. We have created toilets, but created an institutionalized open defecation in terms of the sludge being taken out and discharged in water bodies in open areas. And this is what we are trying to prevent, bring safety to this whole situation. On top of it, we also have the safety of workers that has to be taken care of. It is very, very important. A lot of deaths happen. The numbers show some, we will have much more detailed discussion just to amplify the cause, to say that more number of people die getting into these septic tanks and these network systems, these systems, on-site systems, than soldiers dying along the border in India. That's to show the gravity of the situation. This is a big, big issue. Hence,
Prasachari?
Yeah.
Before you go ahead, would you like to take some questions?
Yeah, are there any questions?
Yeah. So I've jotted them down. I will just relate.
Unfortunately, not able to sort of get the screen right. If you can.
But also, Sir Najib sir is here. He joined. So
yeah, that's fine. Let him. Hi, Najib.
So there are 3 questions around EcoSan and biodigester. Dr. Vishwanath Bishnoy is saying that one of the best technology for on-site sanitation system is biodigester toilets. Mr. Nagesh Patidar is saying EcoSan is good technology. However, we have limited experience of its use at scale. Mr. Hafsa is saying that behavioral change may be circumventing EcoSan toilet, especially at community level. So these were one questions around EcoSan and biodigester. Would you just like to respond to that?
Yeah. So biodigester is a fantastic, DRDO-led technology. There's a lot of benefits. Of course, there are different scientific evidences coming, including IIT Chennai has come up with certain data points to say that biodigester works in certain conditions. It is not a perfect working in all situations. So I will share some literature to say theoretically biodigester works very well, but in practice it has its own limitations. It is not completely. So many public toilets, many public toilets and many railway toilets, they are doing a fantastic job. But there is also some evidence coming up to say that it is not delivering the outcomes that it is expected to deliver. Yogendra sir, would you like to comment? Somebody wanted to say something. The technology has to evolve. I totally agree. Now, with regard to EcoSan, My understanding of EcoSan, and correct me, you are thinking on the same lines. Basically, what we are trying to do is trying to separate the feces from urine, and taking the feces, add ash, you can add earthworms and decompose. That's dry. And then you're diverting the urine, because you need a different type of pan. This is a urine diversion, and urine is stored, and then it, through the natural process, through sunlight, it can be decontaminated, and then that waste, treated urine, can go for agriculture applications or any other applications. There are a lot of experiments that has been done. The nature, human body has a EcoSan. The solid is coming from some location. The liquid is also, God has created us as a EcoSan instrument. उन्होंने लिक्विड और सॉलिड को अलग अलग जगह पे लगा दिया बॉडी में. Rightly so. But the minute you combine them, the problem. The minute you combine even the grey water, bigger problem. So EcoSan is a God's definition in human system, but we tamper it in a real life situation, and the operation and maintenance cost, a little bit of cultural issues. We have implemented in Warangal, we have implemented in number of locations, but convenience issue is a issue. And then people are not very comfortable to add ash. Sometimes it is also not required. It can also contaminate the groundwater if the water table is high. So because of these reasons, the EcoSan requires certain behavior change, and then it has not taken off as it was expected to take off.
Right. Thank you, Professor Chari. Next set of questions is around septic tank. 3 questions again. Ms. Ashraful Islam is asking, what is the BOD of septic tank effluent? Mr. Ranjit Kalita is saying that in case of clearance of septic tank from the 3rd chamber, is it necessary to transport it to STP? So these 2 are related to septic tank, and a related question by Mr. Nagesh is leach pit toilet suitable for urban areas at all?
So theoretically, as per the Indian standard, I will come to that. There is a separate session on containment, because containment is a technology. Septic tank is a technology by itself, but we don't implement it properly. That's why we, as a part of the city-wise inclusive sanitation, as a part of the non-sewer sanitation, we need to get it right. We have a separate session on it. Kindly bear a little bit of patience. We will deal with it. But septic tank should necessarily have a system to take the supernatant water into the ground. And that's where the problem comes. If the groundwater is high, then that's where the water will not easily leach. So the pollution of, if the septic tank is not designed well, then the supernatant water, the liquid coming out of the septic tank will be very, very nasty. It will be carrying it's actually bypassing, the feces will be going out directly. It's actually terrible. And we have done this exercise in a number of cities, taking samples, and it's terrible, especially public conveniences, because the BOD is not working, the septic tank is not designed well. So that's why getting the septic tank design and regulating that is very, very important, and that's the role of city governments. We'll come to that little bit later.
That's it, sir. You can continue with it.
I will continue, and then we will take up some of those questions. Okay, so just a quick, I'm conscious of the time, and Dr. Najib is already there. So what we are trying to do is, we are moving beyond ODF. We are going to what is called, I mean, for many of you, it's very, very common, but I'm just, for the benefit of everyone, I'm adding this couple of slides to say that safe sanitation is not just about building this toilet block and a containment, but taking it beyond this, and safe decanting, safe transportation, and safe treatment and disposal. and that is called ODF++. And that's what Government of India is promoting, the concept of not just ODF, but ODF++. Some terminology for everybody, common understanding. Again, it's known, but just for benefit of everyone, we have what is called a soup, which is a combination of both black water and gray water coming from residential commercial properties. Sullage is basically the gray water which is coming from bathing, laundry, kitchen, which doesn't have the feces. That's called sullage. Fecal sludge is the undigested sludge collected from pit latrines and leach pits. That's why in India we call it as fecal sludge and septage management. The septage is a combination of wastewater and sludge removed from the septic tank. The sludge is at the bottom, the wastewater is at the top, everything is taken out, keeping a little bit of it for digestion point of view, further digestion point of view, hence septage. And sewerage is a network of pipelines. So these are the definitions we use. So fecal sludge and septage management is both coming from the toilet blocks as well as from the pit toilets as well as septic tanks. Now, recognizing the importance of not just providing guidance for sewerage, but sanitation is also about alternate options, interesting options promoted under Swachh Bharat. Government of India has come up with what is called fecal sludge and septage management policies, like in Bangladesh, like in Nepal. Almost all countries are now recognizing this, that safe sanitation is beyond toilets. Hence, they have come up with a number of policies and investment programs. For a common understanding, it is called ODF++. ODF is about eliminating open defecation. ODF++ is about ensuring that whole waste is safely managed. Now, this is important for all of us to understand. Now, if you are designing the program as a citywide inclusive sanitation, you need to have a good policy. And unfortunately, most of the municipal acts, I had the opportunity of drafting Jharkhand Municipal Act long back, about 7, 8 years, 10 years back. Even there, we did not really position it properly. We work with Andhra Pradesh, we work with Telangana. These municipal acts have, even the model municipal act doesn't have very robust provisions for on-site sanitations. Hence, we have to bring an fecal sludge and septage management policy and regulations, and we need to embed it in the municipal act. Now, Telangana, fortunately, had to recently revise the municipal act, and we have loaded all sorts of on-site sanitation provisions in the municipal act so that it becomes a responsibility of the municipalities and the municipal executives to implement. Now, these are the...
Mr. Chari, just
Yes.
1 second. Can you go to the previous slide? One?
Yes.
And the previous one. Yeah. Mr. Mithilesh, do you have a question here? Because you've asked for that slide to come up.
This is 2019 data, so things have improved a little bit, but these keep changing.
Okay, okay.
Thank you.
sir.
Thank you for this.
Thank you.
All these slides will be shared with you immediately after the session. It will be on the learning management. Now, Telangana government is in the forefront in introducing this. Now, typically, our policy framework will have 9 elements. It could be more, but when many of you are in the process of implementing, kindly keep these elements into consideration. Number 1, the first and the foremost thing is design and construction of septic tanks. Second is how to decant, septic tank pumping and desludging, transportation, treatment and disposal, information, education and communication, training programs, record keeping, and also setting up a helpline for septage management. So these are a couple of elements that we find. These are some of the good practices you find in some of the progressive states who thought about it. I will take up some of them for understanding. So what we are trying to do is trying to start moving towards a citywide inclusive sanitation and trying to create what I call the foundations, creating this foundation so that our superstructure and the building comes out, the outcomes come out very well. First and the foremost thing is we have on-site sanitation systems, which are typically septic tanks, pit latrines, bio-toilets. Now they have to be designed well. What is on-site system or a septic tank? It is nothing but an anaerobic digester. It is nothing but an anaerobic digester where excreta comes, the anal washings come, and then it gets settled here. You can have multiple chambers and the supernatant will go out into a soak away. And many a times, because of the density factor, because of lack of understanding, because of lack of regulations, हमारा storm water drain में ये पानी जाता है. That's why even during the peak summer, you will find storm water drains are flowing in our urban areas, in most of our urban areas, because this water is taken directly into the storm water drain. Ideally, it is not appropriate. It should go into a soak away, or it should have a separate collection system and taken to a treatment. It is not in reality. So retrofitting is a big problem in India right now. How do I retrofit existing legacy systems? Now, these sort of designs, this septic tank is codified in IS standard, and it should have multiple chambers for greater retention of the sludge, and the sludge gets settled, it gets digested. That's the whole principle of this. Goal number 4, quickly, Sybil. I'm conscious of the time. Indian Code of Practice for Installation of Septic Tanks. जहां पे भी हम septic tanks करना है, किसके हिसाब से करना है? What is the design standard? What are the specifications? Where is it given? ISO 9000, ISO 14000, ISO 18000, IS 2470. Okay, so Sybil, are you waiting? Yeah, okay. Okay, Sybil, we can announce. So many of you, 44% said IS 2470. Some of you said 9000, which is a quality management system. 14,000, which is an environmental management system. 18,001 is a safety management system. IS 2470 is basically about a code of practice for designing septic tanks issued by Bureau of Indian Standards. Now, this is not known to many of us. It is not known to our town planners. It is not known to our city sanitation professionals. And that's the reason. And it is not known to masons also. It is not known to households. So that's why septic tanks are nothing but holding tanks discharging nasty feces into the drains and nalas without subjecting it to proper treatment. This is the first and the foremost principle of safe sanitation. When you are going for on-site sanitation, it has to have safety built in as per the codes, as per the specifications. Unfortunately, it is not built. We will have a separate session on this, how to institutionalize on-site sanitation systems. Please let me tell you, it is nothing wrong about on-site sanitation septic tanks designs. It has to be executed, that's all. It works wonderfully. Now, there are do's and don'ts about septic tanks, which I'm going to circulate. For example, one important thing is how the slope should be. Generally, we construct a rectangle container, which is absolutely bad. It has to be sloping towards the outlet. This is, you can see here, my arrow. So these are some do's and don'ts, not only in India. It is followed all over the world. This is actually a helpline set up by one of the municipalities in Australia. There is what is called a septic tank helpline. They provide free service to citizens, how to build a good septic tank, and then how to prevent smelly septic tanks and how to get it scientifically right. Nothing wrong. So what do you need for this?
Prasachari?
Yeah.
I'm very sorry you're missing out on all the fun in the chat room. So I'm going to just relay 3 questions. You can answer them very quickly with a yes, no kind of answer.
Okay.
Question is from Mr. Ashraful, and he wants to know that can septic tank treat fecal coliform or does coliform come out with liquid coming from septic tank every day? I think you answered.
So it is like can BOD come down with septic tank? Coliform also will come down with septic tank partially, because you are retaining solids. Along with it, it will be retained. But of course, if you see, the E. coli will be present, different pathogens. The best part is, if your septic tank is working very well, then your problem risk is coming down. Tomorrow, next session, you will hear from Hashimoto-san in Japan. They put a chlorinator at the end. Like our STPs have a chlorination as a last step, or a UV filtration as a last step. Even in the on-site sanitation system, they have a chlorination unit. Even for on-site sanitation system in the Jacoso system, he is going to explain to you in great detail.
Great. So I think that sort of explains next question from Mr. Sujoy, who said that somehow I feel in situ solutions should be the first option before setting up ex situ system with entire chain. Another question is from Ms. Anu Chetal, who says, what happens to the gases produced during the anaerobic digestion?
Yeah, as a part of do's and don'ts, we need to have an evacuation pipeline, but it should be careful because it's an anaerobic system. It has to work in an anaerobic condition. You can't allow a lot of oxygen to get in, but you can have a evacuation pipe to remove the smell, as defined by Bureau of Indian Standards.
Yeah, Mr. Chari, you can proceed and then later on answer.
There is a question on chlorination being bad, must be discouraged. Yes, it is. It is not a great pathogen reduction. Many of the Western societies have gone for ozonation, UV filtration, and so on and so forth. But it's a question of risk. It's very expensive to have on-site UV or on-site ozonation systems. Hence, in India, in US, in many other countries, even developed countries, they go for chlorination even for water treatment. And the residual chlorine is maintained even in the water treatment as well as in the wastewater treatment as a final system. Again, I'm a little rushing it because of the...
No, I think we can get back to your session, sir. Thank you.
Yeah. So going back to... I lost track. Just 1 second. Yeah. So how do I get this? This point someone raised. Do we need to have? Yes, you need to have what is called. Can you see, Dr. Mali?
We can see, sir. We can.
Yeah.
See.
So you can see my arrow.
Can
Yes,
see,
sir, we can see.
We can see.
Yeah.
You have to responsible instantly, please.
Yes.
So there is a you can see here there is a vent pipe to take out the smell and the gases. So as I said, how do I get it right? So in some of the cities that we work, empowerment of masons, training and certification is very, very important. Especially, this is known, but the colleagues from UNICEF who are actually starting this journey in different geographies, please be sure that the masons are empaneled by the municipalities and they are trained and certified, and only those masons and certified masons should be doing this exercise of building sanitation provision in the town. And this has been done in a number of towns in Telangana now, across Telangana and Andhra, and a couple of other states also. So empanelment and training and certification, all the material is readily available. Of course, in English and in Telugu, we will be happy to share with all of this material. Training of masons. The next important component is septic tank desludging, pumping and desludging, very, very important. Now again, very important to regulate this sector. That's a second important component, is the empanelment of the desludgers. Right now, many geographies, many municipalities have unregulated desludging operators. So as a part of your CWIS mechanism, sanitation improvement, empanelment of the unregulated, if municipality is delivering it, great. Like in Orissa and couple of places, municipalities have this septic tank, but most of the geographies, most of the cities in India, most of the urban areas, the private desludging operators, unregulated. So we have to empanel them and we have to train them in the standard operating practices. And then we have to ensure that the PPEs are executed or implemented. And that's the role of the municipality. That's the role of the city leader, engineers and sanitation professionals on this plan. So training SOPs and PPE is a must. These are readily available. And again, I would say, please feel free to use this material, and it's available. It's available in multiple languages, and please use it. Now, these empaneled vehicles have to be tracked. So we introduce GPS systems so that they go to the right place, so they don't illegally discharge. And then they need to be monitored in terms of record keeping is very, very important component of the framework of a strategy. So each of these trucks should be tracked. Mobile applications available, manual recording is also possible. The reason record keeping is important is, number one, you need to have a periodicity of desludging. So like the way we clean up overhead tanks for water once in 3 months or once in 6 months, the septic tanks have to be decanted periodically for its efficiency. The CPHO guidelines speak of once in 3 years. So we need to ensure that every household decants it once in 3 years. In some cases, once in 2 years also. In the case of public conveniences, public toilets, it has to be done once in 3 months because more people are using it. But by and large, it's once in 3 years. That is called the schedule. We need to have a schedule for decanting, and that's where these tracking systems, both manual or ICT-based systems, are important. Now, we have constructed the septic tanks properly. We now have regulated the desludging operators. Now they are taking it as per the standard operating practices. It has to be treated well. Where it has to be treated? In a septic tank or a fecal sludge treatment plant. And this can be done at multiple ways. It can be done. We have a separate session on different technologies, but there are ways of dealing with it. If your town has a STP, sewage treatment plant, it can be co-treated. That is step easiest way. And that's what SBM 2.0 is encouraging us. Swachh Bharat Mission 2.0, the draft guidelines and the new guidelines would be coming out. Even Amrut guidelines, it's under circulation. So the sewage treatment plant co-treatment is encouraged. The second option, if you don't have a STP in your geography, then you need to have a standalone septage treatment. If you have a space constraint, if you have no space constraint, we can go for a very simple biological system with sludge drying beds. But if you have a space constraint, we can go for mechanical dewatering systems, or we can go for an advanced thermal treatment. Now, based on the requirement, the outlet coming out, both liquid as well as the biosolids, can be recycled. And we will discuss that. This is one of the plans that we have sort of collaborated with City of Warangal and one of the Bill and Melinda Gates Foundation technical assistants. We created what is called a thermal system called pyrolysis system. This has very less footprint, where the solids actually are burned or pyrolyzed at a very high temperature of 800 degrees. Number one, it reduces the quantity. Number two, the pathogens get killed thoroughly. This is just
quick.
Yeah.
On this, please.
Sorry.
Quick time check, Professor.
Yeah, I'm done. Almost another 2-3 minutes. The second, another example. This is called GeoBag. There are different technologies. We will bring to you all these technologies during this program. But as an illustration, this is a very simple solution where the sludge is pumped into a bag. This is called a GeoBag. It's a membrane, and the solids will be retained in the bag. The liquids will be taken out, and the liquid will go to the liquid treatment, and the solid will be stored in the bag for 30-40 days, and then it is opened up and then checked for pathogens and helminthics, and it can be used for agriculture applications. All these plants we have established in different geographies. There are multiple technologies are available. Orissa went for a different type of model. Maharashtra is going for a different type of model. We have gone for multiple technology solutions. And if you have a STP, then this is a co-treatment solution. We have a separate session on co-treatment. What are the do's and don'ts of doing co-treatment? Co-treatment is nothing but using your existing asset and then combining the fecal waste sludge into that co-treatment system, into that system. So we need to do a little bit of investment to make it amenable for co-treatment. So I'm just sharing these things with you to illustrate the point that technology is not a problem. We need to integrate these technologies to achieve the safe sanitation outcome. This is a high-end system which is implemented in Baroda now, Vadodara, and this is almost, it is called OP, omniprocessor, where the liquid is treated to such an extent that it is amenable for drinking. So as you can see, Mr. Gates was, demonstrated it by drinking the sewage water. This is nothing but a septage treatment plant, and the outlet of the water is actually amenable, fit for drinking. So this is another important component of citywide inclusive sanitation as part of the on-site sanitation story is information, education, and communication. Very, very important. We need to educate the political system. We need to educate citizens about the need for safe sanitation, why septic tanks have to be designed properly, why desludging has to happen once in 3 years. We will discuss, we will have a session on this. There are a number of campaigns are going on at the national level as well as at the state and local level. This is a campaign which is basically encouraging citizens to partner with the citywide sanitation improvement agenda, and also to make sure that to give a call for action from citizens' point of view. Do's and don'ts. All this material is readily available for you. Please use it. Don't reproduce it. It's all readily available. Please take it as much as you can so that we can move faster. In all this, strict implementation of these regulations are important. Otherwise, it will not work. All this awareness, all this knowledge will go waste if the city leadership, most of you, do not have a regulation in terms of implementing some good practices. If after doing all this, if the waste is not coming to the treatment plant, then you have to impose fines, then you have to make sure that it is properly regulated. Now, final point from my side, is fecal sludge septage management enough to achieve sanitation outcomes? Is FSSM the end in itself? Technically, no, because if you see wastewater, septic tank is only, on-site toilets are only capturing the human feces. The grey water, the bathroom water, the kitchen water, which is also having a pollution potential, goes out in the drains and in nalas. And this contaminates water bodies. If you want to protect water bodies, apart from FSM, we also need to do grey water management. Very, very important. Just to give you a calculation, for a 1 lakh population city, 10 lakh population city, the pollution load coming from grey water is in the order of 25,000 kgs per day. This is the back of the envelope calculation based on the usage of water. And the pollution load coming from fecal load, even if I go for scheduled desludging, is very, very small. So grey water cannot be underestimated. However, the risk potential of the fecal waste is very high. That's why we are prioritizing implementation of fecal sludge and septage management in phase 1. But eventually, we need to start looking at grey water management through centralized, through decentralized system. For example, this is in Warangal. We are introducing what is called decentralized wastewater system for this low-income housing colony, where the grey water gets treated. This is a JEPASO system, which we will discuss, which is implemented in schools, in establishments, decentralized wastewater treatment system. So in a city context, you need both fecal sludge and septage management, but also you need to have grey water management solutions also in a phased manner. But as I said, the risk potential of grey water is lesser than the the fecal sludge and the related effluents. Hence, we are prioritizing it. So to summarize, the citywide sanitation is about not just about technology, but getting all the pieces together. Some of the pieces which I discussed today, getting the policy right, getting the safety, the treatment systems right, getting the institutions right to deliver all this. Right now, no municipality, if I may say so, regulates on-site sanitation. Though many of you in the poll during the day, inaugural day said you're regulating, but often our experience shows that it is very, very less. Fraction of our municipalities are regulating. So getting the authorities to look at it, these are all the principles of citywide inclusive sanitation. I have not covered all the principles, but I have covered to give you an idea. Now what we will do is, I'm very happy to have a real life story of Kampala, which has tied up all these things, pieces together, and brought in a citywide inclusive sanitation agenda in a rapidly growing African city, Kampala. And I'm very, very happy. My brother has joined here, Dr. Najib. Are you there? You can acknowledge me.
Yes, I'm here.
Yeah, you can put in your, you can show your video on. Why are you hiding behind? So Dr. Najib is doing fantastic work. He was a part of the government system in Kampala. Now Dr. Najib moved to Dakar in Senegal, and now he's scaling this Kampala experience to the whole of Africa through a innovation hub. He and his colleagues is a fantastic urban environment expert, water and sanitation specialist. Without taking much time, I would now request Dr. Najib to lead the conversation. What have you done to Kampala? What are the challenges you have experienced? How did you bring regulation? How did you plan? Tell us for the benefit of India, Nepal, Bangladesh. We have folks from all these places. Over to you, Dr. Najib.
Thank you so much, my brother, and thank you for inviting me. So I will now share my screen. Good evening, colleagues, where you are. Good afternoon, my side. Oh, just a minute. I share my screen. Can you see something? No?
Not yet, sir. Are you facing any challenge?
Dr. Najib, use the green color share
Yeah.
screen option. Otherwise, Sibyl can, yeah, I can see that. Yeah, perfect.
Okay. I guess you can see the screen now, right?
Yes, Najib, go ahead. We can see very well. Go ahead.
Okay, thank you so much. Good evening once again, colleagues. Good afternoon from my side. I have already been introduced, so I will not spend quite a lot of time on that. But like I said again, I want to thank you so much for inviting me to share our humble experiences of real groundwork. So I spent over about 10 years in Kampala structuring a sanitation program from scratch when I was young until when I'm now senior also. So this is the story I will share with you today. And I hope you get inspired also. All you get And I know from the discussions we've had, I will not spend a lot of time on some things we already know, but I will try to capture some of the things my colleague has already mentioned. Some urban sanitation challenges, I think he has really covered, the prof has covered a lot on that. A bit on CWIS, and then spend more time on the Kampala approach. Yeah, so like we've already heard from the prof, definitely like elsewhere in the world, we are experiencing rapid urbanization. So this is not new to all of us here. The challenge is most of this urbanization translates into informal settlements. And this is one of the biggest challenge. And you'll see later why I want to underline this. Because when we are talking about CWIS, most of the times we are thinking solutions, and some of these solutions exclude this biggest percentage of our population. And of course, in these areas, you have issues of infrastructure. The bullet number 2 on technical capacity of most of our municipalities is a challenge. And this is one of the things I found in Kampala personally. You have medical doctors running sanitation, running solid waste. You do not have enough staff. The city is run by administrators and less technical people. So these are some of the challenges. Of course, we all know financing, and even when you have financing, how do you utilize it? So you have these poor utilization and allocation of the meager resources that happen. Coordination is critical. How do you integrate the services? So you find municipalities struggling with solid waste, forgetting fecal sludge management or sanitation, or they are focusing on water supply and not leaving out a few other things. So this coordination and integration is also a big challenge. Of course, governance, very important, and at least there has been a very good demonstration of how governance can lead to results from India. At least we've been following. Poverty is an issue, and of course, climate change and health, especially during the COVID period now. A recap of a few things here. Again, so these are some of the backlogs that you'll find that we've had in our cities, and similar to Kampala, definitely, when I started working there in 2011, 2012. So you would find less prioritization of sanitation. I mentioned that already. Inadequate technical capacity, governance systems, poor service coverage, quality and coverage. And I know you must have looked at the video earlier, I was told, so I emphasize this here. And I have spoken to coordination. So all these translate into a cascade of poor sanitation across the entire chain. So you have very poor urban systems, urban planning systems, and these affect the sanitation service delivery, besides the other services of the city. So in planning sanitation on a citywide scale, you need to position sanitation to fit into the bigger urban planning space. This is important. So not just going there and only look at the sanitation, because probably you'll be put off the table. My brother's spoken about CWIS, and so this is where we talk about the CWIS principles a bit, and this will support my presentation on how we approached Kampala to make sure we try to address some of these critical principles. So the first one is really on equity and safety across the entire city. So looking at the organized urban space, the informal settlements, the vulnerable groups, everybody benefiting from the citywide sanitation program. The second one, of course, I wouldn't emphasize it more. I know most of you have spoken to it, the gender aspects. And this is not about building only toilets. I like the program in, I think, India, where one of the cities of building the she toilets. I really loved this idea. But so it's not about providing toilets for women. Participation in the decision making, getting involved in the planning, the designs, getting involved in the appropriation of resources. So it is more than just providing for them. They need to be part of the planning. They also looking at the number 4 is critical. Which institutions have which roles to play in the urban space? This has to be clear to ensure accountability, responsibility, and reporting. And of course, planning, both strategic and action planning. So ideally, every city should have a strategy as well as an action plan. And the last one is not just least important, but probably the most important. You need the political will. So putting these principles in practice, we tried to prioritize a few blocks. So of course, one is to ensure that we developed citywide infrastructure and services where we are not only focusing on the public, but also the private sector, and bringing also development partners in that space. So before, we found everybody doing their things. So we needed to restructure that system. So an NGO coming in space should fit into the picture of the city, not what they wish to do. And of course, informal settlements form a bigger proportion of the city, and therefore we need to focus a lot there. If you address inequalities in informal settlements, then you will have a bigger milestone for the entire city. City-specific policy, so you have the national, but you need to translate these into local. So that was also important. Of course, gender and knowledge management. And as you can see, we are also sharing. And as you share and you benchmark from others, you learn, you keep improving your own systems, as well as sharing what you are doing. So we begin with the institutional. So there was a bigger reform of the city institutional infrastructure and institutions. So one of the intervention was to establish and revamp the City Public Health and Environment Directorate to make sure that sanitation and other elements of public health are dealt with holistically. And you can see that here, what we did was to have two major divisions. So there's sanitation and environment, which I was heading, that included solid waste, environmental management and pollution control, public health and education, water and sanitation, where CWIS and FSM were structured. So you can see that we also had a linkage with our health. So for example, right now, you have a lot, during COVID, you have a very strong synergy between the environment, sanitation, the WASH, and the medical response. To these two move hand in hand. So this was done, and also we made sure that we recruit competent staff to fit in there, very young people, young, energetic girls and men and women to learn on the job, as well as delivering the mandate of the city. On the governance aspect, we had to bring the mayor. So you have the Metropolitan Kampala, and you have different these are geographical municipalities, but we needed to move as the whole metropolitan. So we needed to bring all mayors together, and because sanitation services don't respect boundaries, what happens in one municipality influences the other. So we needed to bring these mayors together. They signed a memorandum for networking, and we prioritized certain collaboration, prioritizing WASH, mobilizing communities. And this framework is also doing a lot of work during COVID right now. They are leading the campaign. They are basically putting sanitation as part of the priorities for their political agenda. So that was the the governance structures in there. You have committees, you have working committees, you have budget committees that support the whole CWIS agenda. The other coordination, so trying to coordinate all partners, the NGOs, the private sector, the utilities, so that you are on the same page. You identify policy directions together, plan together, technical decisions. Okay, sorry, there was an interruption. But okay, so financing and investment decision. So I will give you an example. We said, okay, if we have public financing from the city, where do we put it for infrastructure? Do we construct household toilets, public toilets, or toilets in health centers and stuff? So from the beginning in 2012, we said we have to begin with our schools, where our children, most vulnerable children, funds were directed to schools, and all development partner support funds were then all households. So for us, we knew this money goes to a certain area, and that's where we prioritize. So it is important to sit together, coordinate, and this is a city coordination forum platform. We talked about planning again. So it's not just about the strategy, but also action plan, which is, so you have a long-term strategy of over 20 years. So this was one of my last assignment in the city, to have this long planning. But before this, we had action plans, so annual and biannual planning. So then eventually we decided to have a long-term strategic plan. And for each of these, you have broken down action plan. These are evidence-based planning. So we did a lot of work. We have a citywide sanitation database, so you know where you want. It was to eliminate open defecation and the unimproved facilities by 2030. That is where the focus is. So any efforts towards that is the priority. And this is being broken down into annual plans going forward at a city level. Regulation has been talked about. Capacity, you do not have regulatory instruments as well as enforcement mechanism. So we also put this in place for the first time in Uganda. We probably in East Africa, you have a city level sewerage and fecal sludge management ordinance. This is at city level. Even when we have weaknesses at national level, we do not make noise about national level issues. We need to deal with our city issues. So the city was taking lead to actually guide the national debate on having. So right now we are pushing the policy, and it is being informed by this intervention. Is pushing increasing connection. You know, people like sewerage infrastructure, but the connection never connections, regulation of private sector, putting minimum standards for on-site sanitation in place. I saw the professor as a city, we championed this, and it is being cascaded throughout the entire country. So now they are developing the national. So what you see here is initiatives at city level inspired the ministries to actually start now working on national level aspects. So a city can be a flagship, can be a champion of innovation, and that's what we were doing. We were trying to do. We talked about the whole chain approach. I'll not go through all these, but and again, Prof really detailed this. So we looked at a technical level. We looked at the whole sanitation chain. What are the missing pieces, and what are the priorities? So at household, I mean at capture, it was important to have minimum standards, and we've also adopted the ISO standards right now. So you have a main standards that people can look operators and entrepreneurs to provide these services. And these are being these as well. And all especially in public spaces. So for transport, it was mainly looked at as a business, a private sector-led service. So all efforts were done and have been done to really promote private sector. And the utility, together with the city, worked out mechanisms to ensure that we have increase in sewer network and treatment capacity. Because of the programs at the city level, you realize that the existing facilities we are getting full within even less than a year. So we started working tirelessly to increase this capacity, and right now I think it is increasing. So when we started, we had a capacity of about 400 cubic meters of treatment capacity for fecal sludge alone. And right now that has doubled. So because of that effort. And then innovations in resource recovery. So these are some of, I will again not go into details. I want to really get questions and interactions from you. So for household sanitation, as we said, it was promoting minimum standards, innovative marketing services, and also providing some subsidies to the poor of the poorest. And these subsidies were basically to construct toilets that can work as models in those communities, so targeting the vulnerable poor. And secondly, to support the Mansons to learn on how to build some of these toilets. So translating the minimum standards on paper to practice. This is what the approach was. And right now, this is being scaled up on a citywide level. School sanitation was a big priority, and this was one of the priorities for the city investment. So in terms of pupil stance ratio, for example, by 2012, the stance ratio was 118 to 1. So 118 children, you can imagine, competing for one stance in a school in the morning. And because of that focus, by 2020, we had reached 45. So deliberately targeting that. And each year we had targets. And we're using a mix of technologies. One interesting one was the biogas. And because of this, the strategy, you could see that you could actually easily mobilize financing. For example, we approached one mobile company, telecom company, and ran a campaign of a marathon in the city, and we were able to mobilize financing for building biogas toilets for over 20 schools. And these schools have reduced their energy use by over 50%. And the children are accessing very decent toilets, much better than what they have at home and what they access in markets. And this has a spillover effect over the whole city, increasing demand for safely managed toilets. We are also doing public toilets as a priority, so I'll not spend much time on that. I talked about the sewer network. So we realized that, again, following the CWIS principle, that it was not realistic for Kampala to have even 50% of the city sewered by 2030, the SDG deadline. So we prioritize the sewer into CBD, especially making sure that CBD is 100% sewered. So that is the focus. And that's why you see that the target is 30% by 2040, and making sure that where the sewer is, there is connection, especially the commercial and industrial and the business premises. And then we are also looking at, the professor talked about the decentralized. So here we are looking at condominium sewers. So these are under pilots in 10 areas. And then micro fecal sludge treatment for smaller communities. So these are some of the decentralized approach that we are taking. So other innovations, again, on sanitation marketing, here you see the call center, the mobile apps for tracking, these promotions to promote private sector across the entire city, using existing leadership structures to buy into the vision of the citywide CWIS campaign. Or a mixed approach, but with a very clear target of achievement is basically what we are talking about here. I've talked about private sector, so I will not spend much time on this. But for private sector, really, the focus was on capacity building and regulation and ensuring pro-poor service. So this is where the public financing, blended financing comes in to support the urban poor communities, as well as work with the private operators to offer this service instead of using the public service. Yeah, these are some of the instruments and the incentives for pro-poor support. In summary, one, at a city level, you need political and technical leadership support. So these should own the vision to sell CWIS. If that is lacking, then you will keep doing the same things again and again, and there is no ownership. So you also need a vision. Where do you want to go? And what are the targets? And what are the priorities? Technical capacity is important, and I think this is why this initiative is really great. And also public participation, engaging the public with very innovative marketing campaigns. So you don't put up a campaign in 1 year and run it for 20 years. You know, just imagine you are selling Coca-Cola, for example. So for us, we took that approach of the business marketing. So every year, every 6 months, come up with something new that triggers a certain impact in certain targeted communities. And building donor confidence is important. We have to be realistic. Sometimes, of course, always, public financing is not enough to achieve your goal. So you need donors, you need partners, you need NGOs, you need private sector investment. They must see that you are transparent, you are efficient, you are accountable, and you can demonstrate results. And this is how we were able to attract a lot of corporates to support our CWIS agenda. And of course, private sector participation. But private sector is there to make money. So you need to demonstrate to them that there is business, there is demand, you share the risks, you know. For example, informal settlements, there is probably less ability to affordability. How do you bridge that affordability gap? So as a city, we could chip in with a few subsidies and making sure that the obligations are right and there are incentives for these private. So it's not about regulation, enforcement, but there are incentives to actually invest in this sector. Otherwise, they will take their money elsewhere, probably where there is even more profits than the sanitation. I want to thank you so much. I was rushing through, but I know we shared all these resources, and I'm happy to hear from you and get some feedback. Thank you so much for listening to me.
Thank you, Dr. Najib. Can you
Dr. Najib?
can you take out the slide deck? Stop sharing. You can say stop sharing.
Dr. Najib, your laptop seems to be on need charging. We don't want to lose you.
Okay, so thank you very much. Are there any questions? I know it's we have passed the timeline. It's not a good thing, but since we have exceeded the time and Dr. Najib is here and he has implemented, are there any questions?
Yeah, I would like to just open up. Mr. Pankaj Mathur has put in a couple of questions. I think it will be good if he could just speak. Mr. Pankaj, would you just like to ask your questions?
Yeah, first of all, thank you, Dr. Najib, for such a great presentation. And then it's just, a continuation of what we saw in the, movie which was shared today. And Kampala study, as I already know, that was part of the Coursera course on by EVAC. So this is, of course, one of the best, I would say, case studies on city-wide sanitation. My concern, which I actually also put in the chat box, is about the equity aspect of the overall programming, because normally what happens that when you really go for city-wide sanitation planning, unfortunately what people actually feel in terms of planning is that the most marginalized areas or slum need some cheaper kind of probably the toilets and also the non-seaward connections. And whenever we are really talking about a seaward connection in urban setting, we actually start from those settings or colonies which are resided by high or affluent people. So was there any consideration during the planning in Kampala on that aspect too? So this was my first question. Second is about a general concern from Professor Chari, that if we can actually have one session on the managing the fiscal space for citywide inclusive sanitation. That would be really very good for us, because we know that Swachh Bharat Mission provides an opportunity in India for public financing, but public financing is not enough for CWIS. So how to manage that? Thank you very much. But again, thank you very much for this session. And I didn't even feel that we have actually crossed the time limit for this particular session. It's very interesting. Thank you.
Dr. Najib, would you like to quickly respond on the equity issue?
Thank you so much. Sorry, I had to change YouTube battery. I had to change my location. Are you hearing me?
Yes, we
yeah,
can hear you.
we can very well.
Okay. I had a question on sewer and then financing. If you could just clarify them for me kindly.
No, just Dr. Najib, the question was about how did you deal with the equity aspect in your implementation program? Often sewer systems, typically they target the rich people, and then the poor often get a suboptimal quality standards, quality toilets, suboptimal on-site sanitation system. So how did you balance the equity in this whole implementation?
Okay, thank you so much. So equity takes different forms. First of all, one in terms of investment. So you'll find that many programs focus their investment on the sewerage of the city, and that takes a big chunk of the money and less prioritization of the on-site. So from the beginning, the first equity aspect was the investment prioritization. So rationalization of investment for both the sewer system, infrastructure and network, and two, the other proportion of the investment going to on-site sanitation. That's one. The second aspect of equity is trying to make sure that the services, you prioritize services for both the poor and the rich, or the organized urban areas and the informal areas. But for each of these, you need appropriate solutions. So solutions that work for a CBD, for example, will not work for a very congested urban space. So for a CBD, clearly, the strategy was to make sure these rich people connect to the sewers and they pay the bills and the associated tariffs for the sewer connection. And for the urban poor areas, we focused mainly, I think we had a poll question on whether community toilets are important. So for us here, we focused on public, really public. We call them public is because we cater for the people moving in space and time. And then for the residents in these areas, we support landlords to ensure that the tenants are able to access adequate and appropriate houses. So this is where you put money for subsidy. So for these informal settlements, construct well-designed public toilets. That's one. Two, if you have subsidies, target the landlords in the most vulnerable areas and not the sewered areas. Three, we also tried to make sure that the emptying services in all these areas suits the context. So we have both the cesspool, for example, and the gulping services. So one, the cesspool works for some areas, septic tanks, but in our cities we have pit latrines, so you cater for them as well. So this is where we had, for example, transfer stations. The city invested into transfer stations, mobile transfer stations. So you clearly see, in summary, that right away from financing, make appropriate allocation of financing. Secondly, in terms of technological options, also try, cesspools are the sanction trucks, yes, the vacuum tankers. So make sure you also allocate, invest in appropriate technologies that serve certain areas. So you will not take the sewer to the poor because they can't afford to pay the bill. So these are some of the responses that I can make. The last one is we realize that most of the public schools are serving the poor. So we invested a lot in public schools, like you saw in the pictures. and also public health centers and public markets. So this is where we put the money for the public sanitation infrastructure. Thank you.
Thank you.
Thank you, Dr. Mali. Any other important questions that
Yeah, I mean, there are lots of interesting questions. Like, for example, one from Hafsa Khan. How were new settlements addressed and to ensure that they adhere to the CWIS principles?
Settlement? Sorry, I missed that.
How are new settlements? How do you ensure that all the new settlements are aligned with CWIS principles?
So two approaches. One, you know that in informal areas, these people build without your approval. You don't even need to know that they are going to build. So sometimes this happens. So for such areas, you need to build capacity of the local structures. So you have local leadership structures. In Kampala, we have what we call, besides the health, the village health teams, VHT, you have the community activation team. These community activation teams are actually the one also working on COVID response. So we built capacity of these structures to work at village level. These people move door to door. They know everyone. They know who has come in space. So they are able to communicate. They are actually the ones also involved in business, sanitation business marketing, selling Satopan, linking these people to emptying services, to toilet construction. So building those local structures is important because your health inspectors are not going to be everywhere. That's one. The second is for formal buildings, you have the approved plan. So the minimum standards are now part of the checklist of development control. So before your plan is approved, by default, you must comply. So those are the two dimensions.
this is a very important point that Dr. Najib mentioned. The building approval systems, I'm not talking about the legacy buildings, but the new buildings, they have to be properly checked for right kind of toilet infrastructure, the design standards, like the way we check for fire safety, we check for setbacks as part of the development control. Even the sanitation infrastructure has to be checked. I think that's a great point. One point came from Dr. Najib, one point came from when did you start this CWIS program? Mahmoud Nurul Amin Saab has asked, when did you start CWIS in Kampala? How much time it took to reach the present position, and what are your targets and unique approach that you follow? A very quick answer. When did you start, and then how long it took?
Thank you so much. So, CWIS is not new, but its terminologies keep changing, right? Integrated water resource management, and you turn it. But so we started this program the reforms started in 2010. So the government of Uganda passed a law. So after seeing that the cities were being mismanaged, they passed a law, a new law to bring about reforms in city management. So from a purely political-led city management structure to a dual management structure where you have political leadership leading the governance and clearly designated executive technical leadership taking lead in technical aspects of the city planning and technical aspects. So this started in 2010, those reforms. Between 2010 and 2011, for Kampala City was really transition period. So bringing about establishing a new institution, new governance structure, and all that. So the start of our work I remember we were only about 3 at the city, and very few people. So 2012 to be specific, 2012, and the actual structuring of the sanitation systems started after FSM 2. That was in Durban, if you remember. That was a very good benchmark for us. 2014, we got a small grant from the Gates Foundation. We started structuring the CWIS. So it has taken us to get where we are now, more or less about 6-8 years. Yeah, we can say 10 years. And like you've seen, the alignment of the whole strategy is we are linking to also the global, so the SDG target, but being realistic in contextualizing that to local realities. For example, you cannot eliminate sharing in Kampala for the next even maybe 50 years. It's quite difficult because of the nature of the way we live. So there are realities that we appreciate we can't achieve, but we also make an attempt to comply with the international target. Thank you.
Thank you. I am just conscious of the time again. We take last 2 questions. One is from Mr. Azim Khan and another from Mr. Chenchal from WaterAid. He asked a question, Dr. Najib. You have standards for toilet tanks, different standards. How difficult and how practical it is to implement these different standards in real life situation?
So if I understand the question, they are asking whether there are standards for toilets?
No, you have standards for different standards, as you said in your presentation. But how difficult are these standards to be implemented?
Okay, yeah, so that's a very good question. So the most difficult part for, in the beginning was, first of all, to interpret these standards to the implementers, you know, the local implementers. Who are the local implementers? The users, the landlords, to understand the standards. What do you mean? To the masons, the people who actually build them, the private operators. And 3, even the health inspectors and enforcement officers, they didn't understand these standards, so they were mainly technical. So these were critical challenges. And then the fourth was, there were no models to look at. Ugandans, by nature, they want to touch and feel, and then they know, okay, it works. So they want to see something. You will not just write laws and put them there. They want, so it is very important. For example, if you're working, and in most African countries, you have to put models in place. In my presentation, you saw a mason building a household toilet. So we tried to use public financing to create some of these models in communities. So the neighbor will come and see, okay, these are some of the standards you are talking about. And before, of course, these normal things, popularize them, change them in local languages, and these are different approaches. But the actual problem is practical translation of the standards from the paper into practice. That was the biggest challenge that we faced. And it is up to now, it is just shaping up because of the practical approach which we chose to create models and subsidies to finance some of these standards that we want in schools and in households, health centers, and markets for people to really see and feel them. And also train a big set of masons who can supply the standards.
Okay, Dr. Malini, over to you. Our time is We have overshot.
Thank you very much. There are a few more questions, but then I also have a few more requests saying it's already 7:30 and we need to close. So sorry for that. For those of you whose questions we couldn't answer, but we promise we will take your questions to Dr. Najib and reach back his responses to you positively. That's a promise. So thank you very much, Dr. Najib, for joining at such short notice and for the wonderful, motivating presentation. And we will look back to an opportunity of bringing you back again into discussions in a more interactive format than what we could have today. Just one point for all the participants, today's session was an introductory session, and each component of the regular into a complete session by itself. So whether it is the quality of containment systems, whether it is gender inequity, whether it is sanitation planning or financing, we do have separate sessions, and we shared that with you as the session plan timetable. So please do look at that also. And however, we are taking note of all the comments, and we are able to understand where your focus is and where your requirement is. And we will take those into considerations definitely. So with that, thank you very much for staying much beyond the time, and we look forward to meeting you again on Saturday. Thank you and have a good evening.
Thank you.
Welcome. Bye.
Thank you.
Thank you. Thank you, everyone.
Thank you.
Thank you.